Hey everyone, thank you so much for being here today. My name is Denise. I'm also known as HAIRLOSS on Instagram and Facebook. I am so excited to be bringing you my first ever interview for my YouTube channel. I had an opportunity to interview a Paloma.com doctor, and I am thrilled to be sharing this with you guys. We talked all about hypothyroid disease and how it manifests, how it can relate to hair loss, other symptoms, and the prevalence of it, as well as the the unique benefit that Paloma brings to the table when it comes to hypothyroid specifically, such as Hashimoto's disease, treatment, and even diagnosis. And I think you guys are really going to love this interview. I was on a high all the rest of the day afterwards. I learned so much, and it was just so exciting to be able to talk to an actual doctor, have an extended conversation about this topic, and not feel like I was being rushed out of some office or something. So if you have Hashimoto's disease, if you have undiagnosed symptoms of hair loss, weight gain, fatigue, intolerance to cold, muscle aches and pains, joint pain, things that your doctors are not able to diagnose, you should watch this video. It was really eye-opening to me. And at the end, I will, actually in the description, I will include some links to some information for you guys, as well as a coupon code if you would like to get a blood test done by Paloma to try to determine if there's something going on with your thyroid. I can give you a coupon for $30 off, and it will be $69. It's typically $99. And I have a video where I show you how to do the blood test. So you can go watch that video if you're unsure about it. And at the end, I'm just so thrilled to be able to share some information with you guys that could help you with your health. It certainly is helping me. I'm working with Paloma right now to get my thyroid under control. My Hashimoto's disease is in a flare. I've had a couple of blood tests done by them. I've met with a doctor on a Zoom call. I had my medication adjusted, and I'm about to see if that increase in dosage actually helped me, which is why I did the blood test, and I'm just waiting for the results. So I'm really excited for you guys to see this. Please let me know what you think of this. Was this helpful? This is my very first time I've ever done anything like this. I don't know how the quality will be. It's all new to me, but I think it'll be good enough that you can get some information at least. Okay, without further ado, here's the interview. Thank you so much, Dr. Krantz, for being here today and for being willing to talk to me about this topic. It's something that's really near and dear to my heart since I am suffering currently from a Hashimoto's flare, which I have shared on my channel already. So just for those of you just joining us in this video, I am going to be interviewing Dr. Krantz. I've got a bunch of questions for her, and hopefully she can help shed some light on Hashimoto's and how it relates to hair loss and some other things, and give you guys some good information to start digging a little deeper. And then the other connection here is Paloma Health, which is where I went to get my blood work done and how I started down this path of trying to treat my Hashimoto's, and Dr. Krantz works for Paloma. So it's a great opportunity to introduce you to a potential resource. So that's the basis for this interview. So Dr. Krantz, can you just tell us a little bit about you, what you do, and your interest in kind of integrative medicine and just this whole Paloma Health telemedicine?
Sure. So I'm an MD, and I've been an MD for 30 years plus. I went to medical school at the University of Kansas. I did my residency there. Also, I'm actually trained as an OBGYN originally. I practiced in a variety of settings. I've worked obviously at a university. I've worked in an HMO. I've worked in private practice for a lot of different years in a variety of kind of different ways doing that. And I've also worked in community health settings. So, you deal with a lot of different varieties of patients in those kinds of different settings. Patients kind of piqued my interest in terms of integrative medicine. And mostly because I saw mostly women, obviously, because I'm an OBGYN, and they would come in with questions about hormone stuff and what will black Kush help me, or this or that or whatever supplement. And I'm like, what's that? So, I started learning about all this stuff, and you have to, women are very attuned to their health. and they tend to be the family decision makers about health, like what doctor you're going to go to, what insurance you get, all that kind of stuff. Because I am in my family, I know that, and it's not just because I'm a doctor, it's just the way it goes. Women are the ones who run that. So I started realizing that there was, maybe a sort of a gap in my training, and that I didn't really know about other kinds of modalities, like be it herbal stuff or, other things that were kind of more in the alternative realm. And I also realized there was kind of this disconnect, that women were treating themselves with all this other stuff, and I didn't know about it. And, it really became evident to me when the whole, St. John's wort thing happened. I don't know if you remember that, like when Oprah had St. John's wort on TV, that it became really apparent that all these people were taking this stuff, and like anesthesiologists were like, what's happening to our patients? We can't wake them up, because patients didn't tell the doctor that they were taking that stuff.
Yeah.
And it influences things. So you really need to talk about all that stuff. So anyway, I kind of pursued training in integrative medicine. And it's a different way of looking at things. Integrative medicine is sort of more of a health emphasis. Western medicine is sort of more illness oriented. It's the way doctors diagnose things, and it's the way doctors get paid. Everything is based on what's your diagnosis, which means you have to have an actual illness.
Yep.
Right.
Yep.
In integrative medicine, it's sort of more wellness. I hate using that word because it's so overused, but it's more, I'll say, well-being oriented. Integrative medicine really looks at the whole person. It's really trying to look at mind, body, and spirit. It's trying to look at the person's own capacity to heal. It's considering whatever modalities, all modalities, but looking at it from an evidence-based perspective. So it's not just like woo-woo, totally woo-woo. It's looking at it from an evidence-based perspective with emphasis on safety and emphasis on efficacy. And also looking at it as the patient is a partner. And that's huge, because a lot of medicine now, I think, just because of the time crunch and the way doctors are paid, is not like that.
Right.
It's really looking at more in a collaborative approach, and the kind of like teaching patients and realizing that patients are kind of partners in their own healthcare and their own kind of journey to well-being.
Yeah. And I would imagine that the younger generation, and I'm like maybe people in their 20s, they're a little bit more apt to be willing to be partners versus the older generation.
They want that. They demand it.
Doctor, tell me what to do and I'll just do it.
Right. And they demand it. Your older patients will be like, doctor, just tell me what to do. And your younger patients know. And I'm not like that either. And I sense that you're not like that. No. But so integrative medicine, in my approach, really tends to look at a broader realm. I mean, it tends to look at all the different parts of a person's life, like, how do you eat? What's your nutrition? What's, mind-body connection stuff, spirituality, however you define that, your community, your relationships, movement, exercise, the environment you live in, life stresses that influence you, your situation, and also, of course, your medical issues, whatever diagnoses, exist. But the goal really is well-being. It's not so much that you're going to fix every little picky thing or every little picky lab result. It's more just how do you make this person, quote unquote, lead their best life kind of thing. Yeah. So over the last decade plus, that's kind of been my emphasis, and I do integrative medicine assessments on patients. I've run a mindfulness center, mainly looking at using meditation type techniques to teaching mindfulness-based stress reduction, and we'd have so many patients come in with anxiety issues, autoimmune issues, cancer issues. I mean, just looking for ways to deal with the stress of medical problems. Because the mind-body connection does matter. I've written a bunch of little kids books on this, I have like 6 kids books on this and compassion. Sorry, I'll make a plug.
That's awesome.
That's kind of me. I mean, that's so kind of my journey. And then I have my, I'll tell you in a while, maybe I have my own kind of Hashimoto thing too, my own journey in that realm. So anyway,
sure,
that's me.
That's awesome. So I know kind of generally on my platform, we talk mostly about hair loss and the hair loss journey, and I share about wigs, and because my hair loss really, I don't think my thyroid diseases was the precursor to my hair loss. I think I had androgenic alopecia, a genetic component. It maybe exacerbated it, but that's not how it started. But for some people, that may be how it's starting for them. I think I have a lot of what I call wig sisters following me who don't know why they have hair loss.
Right.
And so I know that thyroid dysfunction is a huge contributor to hair loss. So do you have any thoughts on the connection for hair loss for the people who, some people will find this video because of the Hashimoto's or the topic, but I have a lot of really awesome subscribers who will watch this because they watch all my videos. And so how do they start to think about whether or not their hair loss is related to this?
Well, I mean, obviously that gets into the whole realm of, are they having symptoms that relate to thyroid problems and, thyroid dysfunction? Are you like specifically asking?
Yeah, so hypothyroidism, how does that whole connection to hair loss really come about? Is it I know that the thyroid controls metabolism and some of those things,
Okay.
but why would people lose their hair if they have hypothyroidism or Hashimoto's?
Well, let me explain a little bit about how your thyroid works.
Yeah.
So obviously the thyroid gland is part of your endocrine system. And it's involved in metabolism, and the thyroid gland kind of is involved in everything in your whole body. And it's kind of like a working behind the scenes gland that you don't really know is doing what it's doing, as long as it's doing it correctly. And that's why when people get diagnosed with hypothyroidism or any kind of thyroid disease, it's sort of like the great impersonator. You can think you have 20 other things like you did, and it's really your thyroid, because you wouldn't know, because it's involved. It has its little claws into everything in your body. So the thyroid is part of your endocrine system. It's involved in metabolism, things like temperature regulation, your heart rate, sleep cycles, your weight, all kinds of stuff. And thyroid hormones work at kind of like the brain level all the way down to the cellular level in terms of metabolism. And normally your thyroid gland secretes two main thyroid hormones, T3 and T4. Okay, and that's just what we call them. And the way this works is your pituitary basically, in your brain, your pituitary tells your thyroid to how much thyroid hormone to secrete. And the way it does that is with a hormone called thyroid stimulating hormone. It's pretty self-explanatory. Your pituitary tells your thyroid to, you need to secrete more hormone, and then your thyroid does. If your thyroid's not functioning properly, then your pituitary gland keeps trying to tell your thyroid gland to secrete thyroid hormone. So that TSH level goes up. And that's generally how we diagnose hypothyroidism. Normally in your body, you have T4 and T3 circulating around, but T4 actually gets converted into T3. Okay. Even though your thyroid gland secretes both of them, it mostly is T4 and it's converted into T3, kind of in the liver and kind of at a cellular level. So in a normal person, there's kind of a ratio of T4 to T3 of about 14:1. And that becomes important kind of in stuff we'll talk about later. In hypothyroidism, your thyroid gland just isn't responsive. So it maybe like stops secreting T4 and T3, or it's just kind of like puttering, and it'll secrete some. And it kind of depends where you are on that journey to hypothyroidism as to what it's doing. But you'll get a high TSH, and then you'll eventually get low T4 and low T3. There's different types of hypothyroidism. You have Hashimoto's, I have Hashimoto's. That's an autoimmune disease. And that, you have TPO, I have TPO. That's an antibody. Anti-TPO is what it really is. TPO is actually an enzyme that's involved in production of thyroid hormone. And so, that just shows that it's an autoimmune disease, kind of similar to your juvenile rheumatoid arthritis. But there's other reasons. People can have pituitary failure, or they can, there's just different reasons. But 90% of people in the United States, it's Hashimoto's. In other parts of the world, it can be iodine deficiency, but not here. It's very rare here. And by the way, I'll make a plug for Paloma. They have a really good guide on this. They have like a starter guide to thyroid health that kind of explains how your thyroid works. It's really useful if people want to, look.
Yeah, that's awesome. And I'll make sure I have some links in the description of this video if anybody wants to check more information out.
Yeah. In terms of hair loss, you have to think about it. Hair loss is, influenced by metabolism. It's been influenced by the whole system of metabolism in your body. And it's just one of the symptoms that people can get with hypothyroidism. And honestly, most people don't get that as an early symptom. They tend to get that later. They get hair loss on their head, but they can also get thinning of the eyebrows, especially kind of about the outer third. And it's because of how influenced the whole hair system is by metabolism. The hair cycles, if you wanted me to get into this a little bit, and I'm sure you've researched this extensively.
Yeah, no, it'd be helpful. Kind of my next question was about the difference between thyroid related hair loss and other types of hair loss. So maybe talking about that will lead into that.
Yeah. So, hair growth works in phases, right? There's like an anagen phase, which is a growth phase. That's most of your hair's doing that at most times. There's a catagen phase, which is just sort of like an in-between phase, where the growth is sort of like piddling out, right? And that's like 1 to 3% of your hair at any given time. And then there's a telogen phase, which is like a resting phase, which is 1 to 3 months. And that's when, eventually your hair drops out and then it goes back into the growth phase, right? Normally. So if you think about that, metabolism affects all that stuff. And in hypothyroidism, it can affect kind of anagen phase and telogen phase. And the reason is because anagen phase is the growth phase. So if metabolism's out of whack and, T4 isn't getting converted to T3 adequately, or there's not enough of it, then metabolism's slowing down, and that's going to affect whether your hair grows. Same thing with autoimmune disease. It affects the anagen phase generally. The telogen phase loss, that can get affected by, like, if there's a sudden onset of disease. Like suddenly, like your thyroid hormone goes wacky, like Graves' disease happens sometimes like that. Or if there's any kind of sudden illness, any kind of sudden stress, like a death, you'll find like 2 months later, 3 months later, your hair falls out. That's why, because it really arrested the hair growth, and then all of it fell out. So
that's interesting, because I do hear from a lot of people who are finding me because suddenly they started losing their hair. Really common because of everything with COVID, whether it was actually COVID or the stress of a pandemic or whatever.
And they might not associate it with that because it happened like 3 months later, but that's really where it's from.
Wow, that's so interesting. So I would say, so if somebody is struggling with they can look up Hashimoto's or thyroid disease. They could see what some of the symptoms are. And if they're also having some of those other symptoms, so maybe they've noticed their hair is thinning and they haven't been feeling well, and they've got this, that, and the other thing, it might say, why don't you get your thyroid levels checked?
Yeah, totally. If you go, you want to talk about thyroid levels, or
so what are some of the other symptoms besides hair loss that would indicate that someone maybe would benefit from getting their thyroid levels checked?
Well, there's a lot of different symptoms, because it is kind of the great impersonator of other diseases, honestly. So you notice that you had joint pain. That's not the most common symptom, honestly, but that is one of them. Fatigue is really common. A lot of people complain of weight gain. Cold intolerance, cold hands, cold feet is really common. Low blood pressure, you might take your blood pressure and see that's lower than normal, or you might actually be feeling like, you're having that kind of feeling like you're going to pass out every time you lean over and then stand up.
Yeah.
A low pulse rate, dry skin, dry or peely nails. Constipation's a really common one, or kind of just a messed up system there. Feeling kind of foggy brained, like just not totally like firing on all cylinders. For women, irregular periods is a big one. If you're of that age, loss of libido too can happen. Goiter, your friend might say, hey, your neck looks kind of puffy or swollen. It's really your thyroid gland is swollen. Goiter is like a, swollen in the neck here. And then, obviously the loss in the eyebrows, like I was talking about before. Other reasons, like, those are symptoms, but, the other reasons why you might think of having your thyroid checked is a lot of people have multiple relatives who have thyroid issues. Like my grandma had Graves' disease. My mom has hypothyroidism. That's really common that families will have multiple things. It also might be things like, oh, my sister has lupus. Oh, my aunt has Sjogren's syndrome, which is another autoimmune illness. Those kind of things run in families. So if you have that pattern, that's something that to maybe kind of like, people don't think to mention that stuff to their doctor. That's something
sure.
because that might indicate, oh, well, maybe we should look for stuff like that. Even if it's just autoimmune diseases in general, or if someone's having symptoms, maybe the thyroid specifically.
Right.
Other reasons that people would get their thyroid checked would be pregnancy, honestly, is a big reason, because things tend to manifest as it did for you then. That's not unusual. Graves' disease is a little unusual, but the other, kind of stuff like Hashimoto's or thyroiditis is not unusual. If someone has iron deficiency anemia, if they have celiac disease or gluten issues, that's linked with Hashimoto's for a fair number of people. If they have had any kind of radiation to their neck, head, or chest, that can influence it. And honestly, it's just common. It's so common in women. If you look at medication lists, like thyroid medications are always in the top 5 because it's such a common problem. So especially for women, way more women than men. And honestly, I hate to say this, but as an OBGYN, I will, it gets ignored and sort of like put in the back burner because it's a woman's disease. I mean, by and large, it's a woman's disease.
So how do you diagnose thyroid dysfunction? And along with that, I would like you to, I know that Paloma has the blood spot test and there's other ways to do that test, but I'd like you to talk a little bit about the difference, because I didn't know, Paloma is new for me, and I went to an endocrinologist for years. I'd go into a lab and get a vial or 2 of blood drawn and all of that. So when I first saw this, I thought, how is that going to be accurate? Because I was used to getting vials of blood drawn, not 5 little spots of blood. So talk a little bit about how it's diagnosed and then how this particular blood test is a good one.
I mean, obviously it's diagnosed by a lab test. I mean, a doctor, if you go see a doctor, they're going to do the whole like history and physical kind of thing. They're going to, review your family history, your personal medical history. They're going to, look at, your systems and all that kind of stuff and physical exam. In terms of the actual like diagnosis to definition of hypothyroidism, it's a blood test. So, the standard screening test is that TSH test that I mentioned earlier. So the thyroid stimulating hormone. Most doctors, like if you're getting a blood panel, like your yearly exam or something, and they're going to throw that in, that's the only test they're going to throw in is the TSH. And it's actually a good test. If you're not having symptoms, it's a really good screening test for an asymptomatic population. Now, unfortunately, most doctors follow hypothyroidism with that test as well, which there's a lot of debate about that, a lot of dispute about that, and we can talk about that. But if you have a high TSH and if you have, maybe a low free T4 and free T3, you are by definition hypothyroid. Okay, so the TSH, like I said, is trying to stimulate your thyroid to produce those hormones. Now, you may or may not have an antibody. Some people do and some people don't. If you have Hashimoto's, you're probably going to have an antibody. And there's a couple different kinds, but the main one, like 99% of the time, is TPO, like you were talking about. So one thing I'll mention is, and this is important just because when you ask doctors for blood tests, like Paloma, their panel is a TSH, a free T4, a free T3, and the anti-TPO. Those are the kind of standard things. And that's kind of a standard panel. When you get blood tests, if you look on an actual lab sheet that the doctor orders, there's other thyroid tests for T4 and T3. Like there's a total T4 and total T3. They're not really that useful, and patients don't know that, and a lot of doctors don't know that actually. Free T4 and free T3 are actually what's circulating in the system and actively in use. So it's important that that's what doctors should order, and that's why Paloma chose those labs, which is smart of them. So they do their testing, by blood spot, like you were talking about. Normally, if you go to a lab, they draw a bunch of blood, like you've had done. And, normally they take those tubes of blood and they spin them. And maybe you've seen that actually at a doctor's office. And they get that sort of straw-colored fluid off the top, which is called serum. And that's what they test. They put it into a machine and it tests for whatever you're testing. So the blood spot test is a dried blood spot test. And what you do is you prick your finger and then you drop that blood, as you know, onto this kind of filter paper stuff that's in like a little mailer, and then it gets dried and you mail it in. What the lab does when they get it, though, is basically they kind of reconstitute it. like juice.
Yeah.
They kind of punch it out. They need a certain amount, and that's why they have you get a bigger spot than they actually need. They punch out what they need, and then they actually rehydrate it. So they're really doing the same test. They're getting it on serum. It's just a smaller amount. And it's not as new as you'd think. Honestly, you may not realize this, but your kid who's 22, you were mentioning earlier,
Yeah.
you have an older son, I'm sure he had a PKU test 22 years ago in the nursery, and that's a dried blood spot test.
Oh,
So those
that's
have been
cool.
around forever. And they
Yeah.
also do a TSH test for neonatal hypothyroidism, which is something that is checked also because it can profoundly cause, retardation, mental retardation in infants.
Sure.
So, it's been around. It's not a new test. It's just
Yeah.
new using it this way, which is kind of cool.
It is. It's convenient. And I mean, you don't have to go find a lab. You don't have to find the time. And
Right.
a lot of people don't live near a lab. And so it's sometimes a hike.
Exactly. And the reason I don't think it's become common is because, labs and doctors, they want control over it. And just COVID and the pandemic have changed everything in terms of that, because people can't access their provider.
I have said many times, that's the positive of COVID is this telehealth and other options. We may not have had that yet. I'm sure someday, but this really accelerated that.
It does. As long as a doctor's reviewing the test, somebody's looking at it, it's really useful for people who live in rural areas and, who can't access stuff. And honestly, it gives you some modicum of independence. It's irritating that you always have to get an order from a doctor, quite frankly.
Yeah.
That you can't initiate it yourself. It's
right.
Sort of
and then
do
follow up if it's needed. And if it's not needed, now you didn't have to spend the money on an office visit and all of these things. So you were talking about the diagnosis of the thyroid, running the tests. What are there compelling reasons to need to see a doctor in person since it's mainly diagnosed through lab work? What would be the benefit of seeing someone in person versus being able to do something like this, a Zoom meeting? You've got all the lab and you're talking to the patient.
So it really depends. I mean, obviously, it depends who's interpreting the labs. The problem with doing this kind of stuff is that, not all doctors are equal in terms of this kind of thing, as you found. Even your rheumatologist isn't focused on that, even though technically Hashimoto's is a rheumatological disease because it's autoimmune. That's not her thing.
Yep.
Right. She wants an endocrinologist, but medicine's very fragmented that way, which is really kind of annoying. And ideally you would have an internist or a family practice doctor or an OBGYN who would handle all that stuff. And sometimes that works and sometimes it doesn't. It really depends on the individual doctor as to whether they're interested, capable, whatever. In medical school, we're generally taught, I swear to God, it's like one day that you spend on thyroid stuff and they just say, oh, it's the easiest thing to treat. And it just means your thyroid isn't producing hormone. And here, take this pill and it fixes it. And you just follow the TSH and that solves all your problems. And for a good percentage of people, that's probably true. Like my brother, he's hypothyroid. He could care less. He just takes his pill and he's like, I don't know, I don't have any symptoms. For me, no, it doesn't work that way. So it's really there's a lot of nuances in this disease that doctors aren't necessarily willing to look at. They want to just treat the lab. They want to just treat the test. And that's what you're taught in medical school, quite frankly. And I probably didn't realize that early on either, quite frankly. I'll admit it. Can I tell my story a little bit? Because
Please do. Yes.
It'll help kind of define why I'm interested in this for one, but also like you, kind of why this is necessary, why this is a needed thing, telehealth, as well as doctors who focus on kind of thyroid stuff. Yeah. So, I'm a physician, I've been a physician for decades. And more than a decade ago, I started having symptoms. Mine was also not the usual thing. I was just having a palpitation feeling. I do meditation, for stress. And I was feeling like this, pounding in my chest. And I'm like, I'm in my 40s. Maybe I need to get my heart checked. So I went to, my medical practice where my doctors are and not my normal doctor. Cause I went kind of more on an urgent basis and they do an EKG. Oh, it's fine. And your pulse is, 47. I'm like, that's not normal. He's like, oh, you're just really fit. And I'm like, no, I'm not. I'm not that fit. And he's like, well, I don't know. So, well, your heart's normal. Otherwise, we'll draw some blood tests. And then he calls me and says, well, your TSH is, 9.5. I'm like, oh, well, okay, I'm hypothyroid. He's like, well, you have to go see an endocrinologist. I'm like, no, I'm not going to an endocrinologist. I'm sorry. Regular doctors can manage this stuff. So I call my doctor and she's like, oh, well, it's 9.5. And that's subclinical hypothyroidism. And this is one of the reasons why I got interested in this, because this is so many patients are told this. Subclinical hypothyroidism is defined as a TSH of under 10, which is ludicrous. But nevertheless, she's like, well, we should just check it in a month. Maybe it'll go away. I'm like, okay. I said, okay. So I checked it in a month and I'm like, it's still the same. It's 9.5. And I'm like, well, what about the antibody level? We didn't check that. Can you add that on? I'm like, okay. So anyway, I get her to do the free T3 and the free T4 and the TSH and the antibody. And she's like, why would you want to do an antibody? It doesn't change anything. And this is very typical of what doctors will say. And I'm like, because I want to know, like, what if it's an autoimmune disease? People have one autoimmune disease, they can get another autoimmune disease. And so it's this roundabout conversation, and I could be forceful about it. And I basically could dictate what she was going to prescribe for me and everything, because she's my friend and my doctor.
And you're a doctor, so you have the knowledge.
Well, I'm an integrative doctor, so I knew what I wanted to do. But it's really, I've sort of had this like aha moment that, oh my God, like a regular patient, like, can you imagine getting in an argument with your doctor about that? No. Like, well, why didn't you do this? And why didn't you do that? And you wouldn't even know to ask necessarily. So I got really kind of mad about it, and I wrote this big blog thing on my website about it. And then, I kind of went along my merry way and said, oh, I'm going to do something about this. And that's how I got interested in it. But the patients run into this all the time. The doctors, they mean well, and it's just ignorance, and they know how to treat regular hypothyroidism. I mean, most people, they just say, oh, here, take Synthroid. You're fine. We'll check your TSH. If your TSH is under 4, you're fine. Well, that's not how everybody feels, though. And for you, like, you have a TSH that's kind of in that 9 or 10 zone, like mine was. That's not normal. It's not subclinical if you're having symptoms. What doctors tend to tell patients is, well, it must be something else, like your doctor did. It must be like you're either like it's in your head or it's some other disease, and we should look for that.
Or they call it fibromyalgia, which has no treatment, and it gets you out of their office. And I hate to sound that way, but
so you can go, down this path of like searching for a doctor who actually gets it, or actually listens, and you might find someone. Or, Paloma's kind of filling a niche, and that, that's why I sought them out. I found, like you, I just saw it on something. I was like, this is interesting. And I looked into it, and I emailed them. I was like, hey, you want a doctor? Because, I think there's a need for it. Patients are treated like they're their TSH result. Honestly, in reference to hypothyroidism, it's all about the TSH. Doctors don't want to check the free T3 or free T4. They're just like, oh, just check a TSH. So there you go.
Yeah. And in a sense, I feel really lucky because I've been dealing with my thyroid for over 20 years. And I started with hyperthyroid and Graves' disease. I know that I feel better closer to hyperthyroid on the normal range. Like I want my TSH number to be lower, not higher. I know that's where I feel better, but most people don't know how that all works. They maybe have never gotten the proper diagnosis. And like you said, they don't know what questions to ask. And so that really just segued perfectly into the next question, which is how Paloma, and you kind of covered this, how Paloma is filling that niche and why it's important if you don't think you're getting quite the right answers from your current doctor, or they don't seem to be talking about all of these other things, to seek out a specialist who does know. And because you could be a tricky case, maybe you're not as simple as just a TSH and a Synthroid and be done.
Right. And there's a place to seeing an endocrinologist, obviously. But, endocrinologists, not necessarily Paloma's endocrinologists, but most endocrinologists are just going to want to treat you with Synthroid, and they don't want to consider other options. And Paloma fills a niche. it's obviously an easy access point for thyroid testing, like we talked about. But they also offer, physicians who are interested in this stuff and who have made a point, like I can think of one of the physicians, his wife has Hashimoto's. That's how he's interested in it. Most of them have some kind of connection that way, that they're interested in it, or they just, see a need. Like, a lot of endocrinologists, if they just want to treat with Synthroid, they're most doctors willing to look at other things. The Paloma doctors are. There's different medications you can take for thyroid disease. Yeah. And a lot of the nuances of symptoms have to do, treating those symptoms have to do with what medications are available and what testing you're going to do. So they fill that niche, they only concentrate on that. They're trying to do one thing well, basically.
Right. And it's interesting you say that, because I did some research and learned about, Armour thyroid, for example, or other types of thyroid medications. And I would get into some blogs where they would say it's impossible to get prescribed that, or to find a doctor who will consider anything other than either Synthroid or the generic levothyroxine. And to say that Paloma has said on their website that doctors are open to that. And I do know more and more people are cautious about being pigeonholed into major pharmaceutical medication. I mean, we're just sort of opening our eyes to some things now, and availability is a concern. And so having some options is awesome.
Right. And so let's talk about that a little bit. I mean, there are a variety of treatment options, and, the standard treatment is basically, if you are hypothyroid, let's start at the very basics. Like, if you have an elevated TPO, but you're kind of normal, like maybe borderline TSH, but you have an elevated TPO and, kind of more normal T3 and T4, you might actually not start with medication. You might start with more looking at lifestyle changes, some dietary changes, or certain supplements you could look at, and Paloma has, a whole kind of area on their website about that kind of stuff. So you might go down that route first and then recheck your thyroid, and maybe, that might make a difference. Most people, though, they're already diagnosed with hypothyroidism. I mean, they need medication. And like you found, because you were a little, you have to take the medication every day. And it's generally speaking, once you're on it, you're going to be taking it every day for your whole life. And it's just that kind of thing. You need your thyroid. You will die if your thyroid doesn't work. So if you need thyroid replacement, the standard kind of therapy since the 1970s has been T4. So basically levothyroxine, the brand name that everybody knows is Synthroid, because that was the first one that came out in the 1970s. The funny thing is, that's kind of the main FDA approved drug is levothyroxine. The funny thing is that before that, back in, since like the 1890s, back before the 1890s, people died of hypothyroidism. If their thyroid conked out, you died. Okay, you go into myxedema coma, you die. At some point, they figured out that, oh wait, we could like have people get ground up pig thyroid and take that as a substitute, because the pigs are, how you do fetal pig dissection in schools, because they're really similar in the way they function to humans. So they would actually dry pig thyroid, grind it up, and that would be thyroid replacement. Okay. Then in the 1970s, that got supplanted with, levothyroxine. And ever since then, the party line, and, we won't get into the whole pharmaceutical industry thing, but the party line with AMA and physicians and, Society of Endocrinology has always been, that's the therapy. That's what you have to do. So this natural desiccated thyroid, which is what it's called now, pig's thyroid, is still out there. And Armour is an NDT, natural desiccated thyroid. There's other brands like NatureThyroid, Westroid, whatever, but Armour is kind of the most commonly known. It works great, honestly. It's not for everybody. So it depends kind of, what your situation is in terms of hypothyroidism. The problem with natural desiccated thyroid is that the ratio of the hormones in it is not the same as the ratio in humans. It's like a 4-to-1 of T4 to T3. And in humans, like I said before, that's more of a 14-to-1. And when you take T3, it has what's called a really short half-life. In other words, it wears off quickly. So you have to take it more than once a day. Whereas T4, like Synthroid, it has a really long half-life. So you can take it once a day because it has a half-life of like 5 days. So people like that. That's convenient. You can take a pill once a day. You don't have to think about it, right?
Right. Yep.
Not everybody feels normal on it. It's not enough for everybody. So some people, they need T3 in there too. And that might be via doing something like natural desiccated thyroid, or it might be that you add in T3 because there's also a separate medication you can take called Cytomel that's T3. And this is all stuff that you would discuss with a doctor. You'd have a starting point and, maybe Synthroid or whatever. And then depending on how you feel and what happens with your lab tests, then you change course.
Yeah.
Most doctors don't do that. They're like, if you don't feel good on Synthroid, I guess it's something else. It must not be your thyroid.
Yeah, I guess, and that seems to me to be the potential trigger or red flag for someone if they need to seek someone else out, is their doctor's openness to discussing these other things. I mean, we do have to be our own best advocates and do some research and come prepared with questions. And, if they don't want to entertain other types of medication or other lab results, then it might be an indicator that maybe I need to find someone who will, like a Paloma doctor or something like that.
Yeah. And, if there is another doctor in the practice you go to that you want to try, great. But you can get into like doctor shopping and, not find somebody. So yeah, right. Paloma does fill that niche. And that is kind of a nice thing because, there's more than one doctor in Paloma and they have different viewpoints like all doctors, but generally speaking, they are open to all these different kinds of medications and discussing it with you. And, Paloma also has a thyroid, like a guide to thyroid medication that goes through all this kind of stuff. That's really good.
Yeah. So you talked, I have just a couple more questions, but you sort of touched on the nutrition point. You had talked about, depending on what your lab results are, maybe you don't start with medication, but you look at dietary and lifestyle changes. What are some dietary and lifestyle changes that could be beneficial to someone, whether they're, maybe subclinical or their thyroid is sort of normal, but they've got some TPO or whatever, or someone like me, I'm clearly in a flare. I have all of these symptoms. My thyroid levels are off. And what can nutrition do for me?
So there's a whole realm in integrative medicine that talks about anti-inflammatory diets. And you can, there's different labels for these, but they kind of all fit in the same category. There's like a, thyroid friendly diet, anti-inflammatory diet, autoimmune protocol diet. They all kind of fit in this realm. You can pick a thyroid friendly diet, which really has to do with using foods or eating foods that aren't irritating to your thyroid. So, obviously cutting out things like sugar and processed foods, but there's other foods that are called goitrogens. So things like cruciferous vegetables, like cauliflower and broccoli and things like that, at least raw, can provoke problems. They block the iodine metabolism. So they can promote hypothyroidism. It's not a huge deal. And if you cook them, then that kind of gets rid of that effect for the most part. But, picking a diet that's full of whole foods, kind of like more in the organic realm so that, you get rid of the pesticides and all that kind of stuff, anti-inflammatory, like good oils, like olive oil, that kind of stuff, in terms of picking a diet. The other thing, like someone like you can do, or folks who are trying to kind of figure out like, well, is there an instigator in this, is they can do like this autoimmune protocol diet, which is basically, if you've heard the term elimination diet, it starts you kind of from scratch and you eliminate a lot of the foods that can provoke problems for people. So things like gluten, things like dairy, things like corn, soy, eggs for some people, things like that. And then you track it. And you add those foods back in and you see, oh, wait, did this cause my symptoms? But you do it kind of piece by piece. It's kind of a pain in the butt to do, but if, it can really be worthwhile for people. So that's one way that you can approach it,
Sure.
Other things you can do, obviously you can look at possible thyroid support supplements, things like tyrosine, which is involved in, hormone production, thyroid hormone production, selenium, which is a mineral that's also involved, zinc and D3 and B12, all those kinds of things. Paloma has a supplement actually that you can get, but you don't, it's not like it's that unique. I mean, you can get it elsewhere. Hair loss wise, I mean, there's other supplements you can go down the road of like biotin and making sure you're not iron deficient and fish oil and things like that. And all those are beneficial too, but the ones that are specifically for thyroid are more like tyrosine and selenium.
Have you seen people in your practice who were suffering a hair loss was maybe a symptom of their thyroid and whatever was going on with their thyroid, and they got on the right track with it, their levels got and their symptoms were right, and their hair started to grow back? I mean, is that something that you've seen?
You do see that, but honestly, there's so many things going on at once. So you don't necessarily say it's, oh, I added selenium and that's what did it, because you're also working on their thyroid. And honestly, that's the big thing is if you can get their thyroid leveled out, they're probably going to stop losing their hair and it's going to start growing back.
Sure.
So, that's probably the biggest thing. The supplements, I think they're great to use for support in general. But I think for folks who are in that kind of like gray zone where they're not overtly hypothyroid, and they're sort of like working with just like, I have sort of this vaguely elevated TPO, but I don't, and maybe a borderline TSH, they're the ones that I think, can benefit from doing these dietary changes in the supplements. They also don't tend to be the people who have hair loss though, just so you know.
Right. Yeah. Like you said, it's not the first symptom that we see. Right. So if somebody's not have a ton of other symptoms and they have hair loss, it may not be thyroid related. And there's lots of reasons why we lose our hair. So, yeah. So that's kind of wraps up the questions I have. So at the end of the day, I think, what is your best advice to someone? They're listening to this video, they're watching this video, they've maybe got some symptoms or they've seen a doctor and they've been told they're fine, but they don't think they're fine. Do you think that it's probably a good idea to maybe get some independent lab results through something like Paloma? Just what would the next step be for someone?
Yeah, if they're told they're fine and it's probably just based on a TSH level, because that's usually the screening test, delve into it further. I mean, you can either seek another doctor or you can seek out something like Paloma and get a more thorough testing and see, it's a really prevalent problem. I mean, hypothyroidism is huge. It's like mostly women, like we talked about. And, if that is the problem, or even if it's just like elevated TPO antibodies, you have Hashimoto's, even if it's subclinical, you have it. So then you can start pursuing like, well, what changes do I want to make in my life that might make me feel better? And who can I talk to about it? Somebody at Paloma, or, taking those lab results and going elsewhere is always an option. Because
it seems like it's possible that you will be slightly elevated or have something and everything else be normal. So you're at the beginning phases of this potentially. And if a doctor isn't checking all that, then you're not finding that out.
Yeah, hypothyroidism is sort of like a progression for most people. And it depends where you catch it on the progression. Most people like you and me don't get caught until their TSH is like, 10. At that point, you probably are not going to reverse the problem. If you catch the person and their TSH is like 3 or 3.5, which is still considered normal, but it's actually kind of on the elevated side of normal, and they have TPO antibodies, you might be able to do something about it. You might be able to make some changes in your life in terms of reducing stress and anti-inflammatory diet and certain supplements that might actually do something. Or at least delay it, which might be worth it and honestly make you feel better.
I think that's probably the key with everything nowadays is looking at our lifestyles and making positive changes to either delay what may eventually happen. I think, for those of us with autoimmune diseases, it's often we don't know the cause, but there's some sort of trigger, whether it's stress or it's an illness that kicks it off. You had a predisposition toward it. So being able to catch it early may mean that you can reverse some things, not a guarantee, but I think that gives people hope, but also may kind of push someone to say, okay, maybe I will get myself checked and try to figure this out before it's too late.
Right. And it also means, maybe we should be screening people more for this kind of stuff because we don't, you tend to not screen people until they're older or they have symptoms and, or something like they're pregnant, there's some kind of reason to do it. We don't, it's not just the standard, like, oh, go get your pap smear and get a thyroid test. That's not what happens. And maybe we need to be doing that because we're probably missing a significant number of people.
Yeah.
So there you go.
Well, thank you so much. This has been so interesting and I love learning about this stuff and it's just been really enlightening. And I'm sure there are people who maybe had no idea about this are now thinking, maybe I need to look into this more. And for those of you watching, I actually have a coupon code for you. I can put it in the description of this video, but it will get you $30 off a blood test, the blood spot test through Paloma. So if you want to get your thyroid checked and just try to determine, do I need to take a direction with this? You can do that at a $30 discount, which is huge. And so I just think this is awesome.
can I make just a little plug
Yeah.
for Paloma? It's just got all kinds of educational stuff. I mean, even if you just want to learn about, like you think you might be in that realm, they have all kinds of articles and recipes, and they talk about the different dietary changes, and they have symptom trackers on their app and lab result trackers. I mean, it's kind of cool that you can do that kind of stuff and just have it on your phone.
Absolutely.
So it's worth just like perusing, just to kind of see. So.
Yeah, for sure. Well, thank you so much. This has been great. I appreciate this so much. And if you, if somebody, you said do you have a website, or how can people seek you out otherwise?
They could seek me out on Paloma, or they can, Heather Krantz MD is me. So heatherkrantzmd.com is me. If, people want to seek me out. But yep, that's it.
Awesome. Well,
thank you so much. I appreciate it.
You bet. Talk to you. Maybe I'll talk to you in a future appointment, because I'm going to get some follow-ups. So who knows? Maybe I'll get an appointment with you.
Cool. All right, Denise. It was great talking with you.
Bye-bye. Thank you.
Bye-bye.